Okay, so I'm Wolf, and I'm doing this video because, frankly, I'm a little burned out from being asked how to operate the advanced GSMSG system. So we have everything, we have our surgery. I'm joined by my two helpers, Morsel and Tybo. So what Morsel is going to do is, Morsel, if you could please go out into the distance. So what we're going to do is we're going to cause critical, and critical is basically surgery, but part 2, and worse. So a good way to achieve this is an explosive. So what we're going to do now is we're going to walk over. We're going to assess our patient. So we put on tourniquet to stop the bleeding. We go to airway. We put on the endotracheal tube. Tybo, if you could please put on an IV starter kit in medicine. And what I do now is I go to resuscitation. I click defibrillator. Usually if the defib doesn't work, you can do chest compressions to stabilize until you can do a defib. So what I'm going to do now to get the critical taken care of is I'm going to click scalpel. I'm going to ask Tybo to please click suction. I'm going to click clamp. He's going to click 5-O-proline. Tybo, please click 5-O-proline. So what you're going to see is it goes from critical to sutured. Now we click 4-O-nylon. Now, because that's gone, critical is no longer an issue, but we have surgical to do. Surgical is usually what you'll encounter. So again, scalpel. Tybo, please click suction. I click catheter. Now I can do balloon. I can do 6-O-proline. And you'll see that sutured pop up again. That means that the wound is basically closed. We can do balloon again to deflate it, take out the catheter, and we do 4-O to stitch up the hole again. So our surgical is now all solved. We can go to circulation. We can take off our tourniquet. Now what we can do is we have injured and pain. We go to medicine splint it. We put in ketamine. Keep putting in ketamine. Tybo, please finish the ketamine. And now what I'll do is I will go to take off my oxygen therapy. And I will now go to medicine and splint. I click epinephrine to revive Morsel. Then I go to circulation to put in some more blood. And then once the blood is refilled, I go to medicine and I take out the IV. Simple as that. So what you can also encounter is this situation. A gunshot wound to the chest. So what's going to happen in this situation is what I will personally do is IV, circulation, tourniquet, back to medicine and splint, and I'll click anesthetic. What that'll do is it allows me to just put the endotracheal tube in, and then I can go to O2 therapy. Immediately like that. Normally, you'd have to do the nasopharyngeal airway, then your non-rebreather, and then your O2. That's if your patient is conscious. So, but because I put him on anesthetics, he's unconscious, so I can just bypass the non-rebreather. So again, surgical. This would be a normal procedure. I click scalpel, my assistant Tybo will click suction, I put in the catheter. Now, I will click balloon, it inflated. Now, I click 6-O, sutured. Now I click balloon again, it deflates. I click catheter again, take it out. I click 4-O to stitch up the wound. And just like that, it's now disappeared. So, again, what I do now, take off the tourniquet. Tybo, please administer ketamine. I'll put on that splint. And while he is administering ketamine, I will take off my oxygen with O2 tank and endotracheal. And then I will go back to medicine and splint. I'll click epinephrine, circulation, to give him blood, and then I take out my IV. And just like that, we have a fully capable war-fighting patient.